Well, thank you very much. I'm very happy to be here with you, and I would like to congratulate the previous speakers. Those were excellent presentations with very important content. I deal with the population health management at Philips, and I would like to give you an example of a number of recent implementations. I would like to speak to you about how these solutions can help in managing patients suffering from chronic illnesses and at high risk of strong symptoms of COVID-19. So Mayo Clinic was the first place where we introduced our solutions in 2006. Since then, we have developed with over 6 million users among patients and 70,000 users at the side of medical health professionals. That's clinicists. So the solution I would like to speak to you about connects patients and their needs, symptoms with the doctors, with physicians who are responsible for the triage and coordinating the patient. So this could be called a checklist or questionnaires based on which prioritizing is made, triage is made, and patient risk is evaluated in order to make a decision as to what services are to be provided for the patient in order to mitigate the risk. So if we look at this solution, its advantages and its particular features, in the first column we can see the patient interface. And this is something that the patient sees at the end of the app, at the level of their app. In this app, they can open it on the mobile device, on the computer using search engine, and they see questions that would have been asked by a doctor during a consultation. So depending on their particular health status, they would receive questions pertaining to their risk factors, their illness, and their health condition. Then those questions are scored and they are presented at the interface of a coordinator or a physician. Depending on the risk level, the number of symptoms reported are flagged as high risk or assessed as medium or low risk. So depending on the risk level, we then take a decision as to what needs to be done about the patient. At the level of this solution, we can organize a secure video conference. A coded video conference. We can recommend or prescribe a test for COVID-19 or also other tests, examinations, and services. So this would be very similar for different chronic disease. We want patients to be able to report their symptoms over time in order to avoid receiving support directly, replacing this direct personal contact with teleconsultation or e-consultation. So we have recommendations for the patients who receive support. Patients need to give consent, and then they are required to fill out the questionnaires on a regular basis. Then they receive a link. Link includes a list of questions which are designed for their particular health problem. And then we are able to authenticate at two levels with the PIN number or the text message identification. Then the results of the questionnaires appear at the end of the service provider, be it a physician, a clinic, or a hospital, and then consultations are recommended or teleconsultation is offered. And then at the last column, you can see that this information can then be used further in order to take decisions that would help to optimize health programs or healthcare programs. Because when we compare the results and then when we look at the cost, we are able to actually assess value per patient, choosing those therapies which are most effective and also cost effective. And as for the implementation, in the case of Mayo Clinic, reporting with patients of osteoporosis and also at the risk of hip replacement were monitored, and those patients were very engaged. They reported the results, which saved the time of physicians. Physicians received information which made it possible to consult each patient quicker and to set a physical consultation. Then the next example from the Netherlands. There we were monitoring oncological patients. For example, we had a patient who suffered breast cancer and was operated, and then between chemotherapy series they were able to report the health status and that made it possible to make the correct decisions, and it also enabled us to avoid hospitalization or actually to reoperate. Then we had HIV positive patients suffering from AIDS, and this is also in the Netherlands in OLVG hospital. Patients were able to have online consultations, reducing the number of physical visits to 1 per 6 months. We also improved the health status. We were able to optimize the blood tests and so on and so forth. And then we were also able to optimize the premiums. And in the Netherlands, it's important because we have a free market there in terms of. And then we had a mental health center in the Netherlands, and there we were able to allow the patients to continue living at home in their community, being able to monitor the symptoms, which improve the quality of therapies, and we were able to create a therapy circle with access to results given not only to the leading centers but also the community assistance. We were able to reduce hospitalization, and patients were able to stay at home in their communities. And there another example from the Netherlands, from Dillenburg Health Center. And in Dillenburg, we had a whole range of chronic diseases, and we were able to reduce the number of physical consultations. They were replaced by e-consultations to some extent with some distance measurements and tests. And then we improved the soft outcomes, the improvement in terms of comfort and quality of life for the patients. And the COVID-19 related solutions in Gouda in the Netherlands, we were able to make sure that risks was assessed for several thousand patients. For over 1,000 we were able to decide. So we had the screen questionnaires for 13,000, then another checklist for over 2,000 patients, and then teleconsultations for 286. So we also have another solution with Dom Zdravlje in Zagreb in Croatia, and there 900 primary care physicians will have access to the application. They will be able to assess risk and also to remain in contact with patients as the risk can change over time. They can perform triage and they can coordinate services provided for patients. And as for the Central and Eastern Europe region, we have a solution for post-stroke patients, analyzing how quickly they return to the labor market, which centers are most effective in treating patients, which can actually learn from other centers. So this is our pilot in Estonia. And we are the technological partner hoping to achieve results. And if we do achieve results, this contract will be prolonged for another 2 years. We can see that there are 2 more hospitals that want to take part in this pilot scheme, which is connected with restructuring the refunding model, because there is a certain mix of services provided for patients and selected by hospitals, and we are able to monitor whether we are able to achieve a health result based on this selection. So summing up, as for the data processing in the computing cloud, we have the appropriate ISO certificates. We are certified both in terms of our software and devices. So we help to design the architecture to adapt it to the needs of a given service provider. We host a solution in a secure environment using a safe host on the territory of European Union. We also help with the maintenance of these solutions, and this is also can be integrated with the HIS systems. It can be part of the patient history, a patient documentation. So this can be part of the comprehensive care of the patient. Thank you very much for your attention.